Marcus for his 5 minutes.
Thank you, Madam Chair, and it's an honor to sit in this chair next to you as ranking member, even though it's probably for only 2 minutes. I'll take it. Again, Mr. Riccardi, complex Medicare enrollment rules and lacking notification cost tens of thousands of older adults and people with disabilities that face lifetime fines, which I think is ridiculous, coverage gaps, and other harmful consequences. With fewer people automatically enrolled in Medicare and 10,000 baby boomers aging into Medicare each day, more people new to the Medicare must actively enroll in the program. In your estimate, what percentage of seniors today have a proper understanding of their current Medicare eligibility and the enrollment process?
So thank you for your question. And, currently, as more and more people are working longer, there are millions of people who are not well informed about their Medicare coverage because they're not receiving any notification about that. They're relying on information from HR departments, from benefit administrators, from commercial insurance brokers. And so currently there are, approximately only 60% of people are automatically enrolled into Medicare. So that's millions of people who are going uninformed about these basic enrollment rules and the penalties, as you had mentioned, these lifetime penalties associated with them. And this problem is only going to snowball, as you mentioned, with 10,000 people every day turning 65.
Yeah. So it looks like we have an easy solution here with this bill.
Yeah, very straightforward.
Again, can you explain how seniors might confuse the merits of delayed enrollment into Social Security with late enrollment into Medicare? I mean, it is complicated.
It is very complicated.
Yes.
And so, most people, the people who are receiving their Social Security benefits, enrollment is automatic and it's streamlined. People are automatically enrolled in Part A and Part B, and then they can choose a drug plan or Medicare Advantage. For older adults who are continuing to work, or who are waiting to collect their full retirement benefit, they have much more to consider, whether Medicare is going to be primary or secondary, and then they're juggling multiple enrollment periods, an initial enrollment period, a special enrollment period, a general enrollment period, and none of these periods are aligned. And so what the Bennies Act will do, it will prevent many of these errors from occurring by providing a simple notification a few years out before someone turns 65, versus individuals kind of scrambling after they've turned 65 and realize that they've been working their entire life, they've had insurance, and then once they're eligible for Medicare, they're locked out of the program for several months. It's very unfair.
Well, as far as, so again, obviously people have to have a sense of responsibility, but how are they going to be informed? We're talking about emails, we're talking about letters, hopefully with big letters, big font, because I have a hard time. I need big font.
Yeah,
and I'll be a senior pretty soon.
Yeah, well, one thing that I've observed over the years and what we've heard from our helpline clients is that when Social Security or Medicare sends a mailing, people open it and they read it. And what the Bennies Act will do will provide notification as part of somebody's Social Security annual award statements. And for many of you, if you've spoken to someone who's near retirement or thinking about retirement, they're starting to wonder, well, how much can I collect at 62 and 65 and 67 and 70? And so providing this information as part of that notice will ensure that people are obtaining it, and then they can make more informed decisions around whether they should enroll into Medicare Part B.
Thank you very much. Madam Chair, the Bennies Act is important to help individuals who are approaching Medicare eligibility, but as we all are aware, there are many issues that beneficiaries face once they are enrolled in Medicare, and I'm sure you'll agree, and begin accessing services and filing claims. Once those have to do with the, one of those things that happens to do with Medicare is reimbursed in its secondary payer status. That's confusing too. I co-sponsored a bill with Congressman Kind, and it's called what's HR 1375, the Provide Accurate Information Directly, or the PAID Act, that would help achieve efficiencies for beneficiaries, though better information sharing, again, through benefit better information sharing. I'd ask members of the committee to consider that particular bill and maybe co-sponsor the bill, and I'll yield back, Madam Chair. Thank you.
Gentleman yields back. Now I'd like to recognize